Hi, my name's Sarah Maloney. I'm a registered nurse and certified child passenger safety technician. In this video, I will discuss some basic needs of postpartum and what you can expect in the coming weeks. All the information discussed today will be covered in your discharge packet. Keep it on hand after going home, as you may need to refer to the resources given for any questions. It may also be helpful to have a pen and paper handy while watching this video to write down any questions so that you can discuss them with your nurse or healthcare provider. This video gives you general understanding of you and your newborn's care, but always follow your healthcare provider's instructions. Also, please keep all follow-up appointments for you and your baby. These are very important to ensure you're both doing well in the coming weeks.
Let's first discuss some limitations at home. Gradually increase your daily activities until you return to your regular routine. No strenuous activity or heavy lifting for 2 weeks or until your healthcare provider clears you to do so. If you have other children, cuddle with them and read to them, but avoid picking them up and carrying them around. It is recommended that you not insert anything into the vagina for the next 4 to 6 weeks or until your provider clears you. It is essential to know you can get pregnant almost right away, even if you're exclusively breastfeeding. Be sure to talk with your healthcare provider at your follow-up appointments about birth control options. Driving can generally be resumed once you are no longer taking narcotic or opioid pain medication and feel comfortable performing emergency maneuvers, typically around 2 weeks postpartum. Swimming should be avoided until the incision is fully healed and lochia has stopped, usually around 6 weeks postpartum. Immersion in water before the incision is healed can increase the risk of infection. Showering is generally safe soon after surgery, but tub baths should be avoided until the incision is fully healed, typically around 4 to 6 weeks. Light activities, such as walking, can be started soon after surgery, with a gradual increase in intensity. Abdominal exercises should be avoided until cleared by your healthcare provider, usually around 6 weeks.
It is important to take care of yourself after having a baby. Well-rested parents often feel better capable to care for their babies. You will most likely get less sleep now that the baby is here, and the sleep you do get is often interrupted. Make it a priority. Take a nap when the baby sleeps. The dishes or the housework can wait. Do not forget to ask for help. When others offer, say yes. Take a nap, take a shower, go for a walk, or visit with a friend. It's still okay to do things for yourself.
Your hormones have a significant impact on your feelings and emotions. Your placenta has been giving you a surge of hormones throughout your pregnancy. Now that you are no longer pregnant, that has changed. Feeling overwhelmed, tearful, and crying for no reason can be expected in the first few weeks, but we call this baby blues. However, if these feelings last longer than 3 weeks, it is time to contact your healthcare provider. These feelings could indicate postpartum depression or anxiety. It is important to communicate with your healthcare provider if you feel this way. If you're having any thoughts of self-harm or harming your baby, call 911 immediately to get help or dial 988 to reach the Suicide and Crisis Lifeline.
Drink plenty of water to stay well hydrated. It's okay to resume your regular diet. Try to eat foods high in fiber to keep bowel movements regular. If you are breastfeeding, you may need about 500 additional calories a day to produce milk for your baby. Continue eating healthy, lots of fresh fruit and veggies, and avoid processed and fast foods.
If you had a C-section, you may go home with prescription pain medication. If you don't feel that your pain is adequately controlled and manageable, talk to your healthcare team before you go home. Review your medications with your nurse and be sure you're clear on what medications your provider wants you to continue and what to stop. Your healthcare provider will also instruct you on safely taking over-the-counter medications with your prescription. After birth, pain and cramps may be noticeable in the first week after delivery. These contractions compress the blood vessels within the uterus to help prevent excessive bleeding. You may notice them more while breastfeeding. Use comfort measures such as deep breathing. If you're having severe abdominal pain, your abdomen is tender to touch, or pain is not manageable with medication, call your healthcare provider, as this could be a sign of something more serious. Continue to take your prenatal vitamin for 6 weeks or as long as you're breastfeeding. Continue your stool softener until bowel movements are back to normal.
You may notice an increase in sweating and urination as your body works to eliminate the extra fluids from pregnancy. Try elevating your legs and avoid standing for long periods of time to minimize and cope with the swelling. If the swelling is accompanied by chest pain, shortness of breath, or calf pain with increased redness and tenderness, call 911.
Your breast and nipples have probably changed or grown in size throughout your pregnancy. It is vital to continue to take care of them. Lactation will be visiting with you throughout your stay. Your breasts produce colostrum in the first few days of your baby's life. Colostrum is highly concentrated and nutrient dense, even in tiny doses, so your baby's tummy doesn't need a lot to reap its benefits. Your milk will generally come in fully 3 to 5 days after delivery. At first, your breast may feel overfull and leak, and this is normal as your body learns how much milk your baby needs. However, everyone is different. Not all women will experience this. Once your milk comes in, let your baby finish feeding from one breast before moving on to the next. This gives the baby all the fatty milk along the chest wall and helps reduce the chance of mastitis and engorgement. Mastitis is a breast infection that can develop in one or both of your breasts, making them feel very warm and tender. The breast may be red, shiny, or streaky, and you may have fever and flu-like symptoms. If you think you have mastitis, please reach out to your healthcare professional for further guidance. Engorgement may also happen if you do not empty your breast frequently. Try breastfeeding before your breasts get too full. If your baby is having trouble latching because of the engorgement, hand express or pump for 1 to 3 minutes before feeding to relieve the pressure in that breast. Using cool packs can relieve pain from engorgement. However, consult a lactation consultant on best practices. Please take time to review your breastfeeding discharge instructions. This will be helpful over the next few weeks.
If you are not breastfeeding, wear a tight-fitting support bra. You may also need pads to help with leaking, which may continue for several weeks before milk completely dries up. Avoid stimulating, heating, and facing the warm water in the shower to decrease milk production. Cool compresses can relieve the breast if they become engorged or uncomfortable. Your vaginal bleeding, also called lochia, will continue over the next 3 to 6 weeks. It is important to change your pad regularly to prevent infection. Like your period, bleeding should get lighter as the days go by. By week 4, bleeding and discharge should be minimal as the uterus heals. Unlike your period though, the vaginal bleeding you are now having is from where the placenta was attached to the uterus. Do not place anything inside of your vagina over the next 6 weeks or until you're cleared by your healthcare provider. For example, no tampons, no douching, and no vaginal or anal intercourse. It is normal to pass small clots, especially if you have been sitting for a while and then stand. Notify your healthcare provider if you have clots the size of an egg or larger, if you have heavy, bright red vaginal bleeding, or you're saturating a pad within an hour. Call and report this to your healthcare provider right away.
Your nurse will discuss when and how to remove your bandage. Most of the time, your doctor will want it open to air. Make sure you know if your doctor has any specific instructions regarding dressings, sterile strips, or skin adhesives. Once your bandage is removed, keep your incision clean and dry and inspect it daily. Let warm soapy water run over your incision in the shower and pat dry gently with a clean towel. The skin from the incision will heal in several days. The full depth of the incision takes about 6 to 8 weeks to heal completely. Try splinting your abdomen when you cough or laugh to help with discomfort. Log rolling to get out of bed can be helpful for the first few weeks. If you experience a fever of 100.4 degrees Fahrenheit, increasing abdominal pain, redness, discharge from the incision site, or your incision opens, seek medical assistance immediately.
Mild burning when you urinate in the first few days after delivery can be normal. However, if it lasts longer than a few days and is accompanied by frequency, urgency, or lower back pain, it may indicate a bladder infection and need to be reported to your healthcare professional. We also recommend emptying your bladder every 2 to 3 hours, even if you don't feel like it. Constipation can be minimized by gradually returning to normal activities and eating foods high in fiber, whole grains, fruits, vegetables. If you have not had a bowel movement within 3 days after delivery, call your healthcare professional. Hemorrhoids are varicose veins of the rectum caused by the weight and pressure of the baby and the force of pushing. Cold packs, sitz baths, medications, or witch hazel pads will help decrease that discomfort. Avoid becoming constipated or standing for long periods. Do not place ice directly on sensitive tissue. Always use a barrier or a commercially bought ice pack so as not to damage the skin around your genitals. Limit cold treatments in this area to 10 to 15 minutes at a time.
Call your healthcare provider or come to the emergency room if you are bleeding through a pad an hour or passing clots the size of an egg or larger. You have a foul odor coming from the vaginal area. Increased redness, swelling, pain, or pus at your incision site. Burning or pain with urination. Severe tenderness or redness in your breasts. Severe headaches with changes in your vision. A temperature over 100.4 degrees Fahrenheit or 38 degrees Celsius. Calf pain with increased redness, swelling, or tenderness. Nausea, vomiting, or difficulty having a bowel movement. Call 911 if you have chest pain, shortness of breath, a seizure, or you are having trouble breathing. You're having thoughts of self-harm or harming your baby.
We hope this video has been helpful. If you have any questions regarding further instruction on how to take care of yourself or your baby, please discuss with your nurse or healthcare provider. We thank you for delivering with Infirmary Health, your first choice for healthcare in the Gulf Coast region.